Hello, I'm Tara Mastracci. I work at St. Bartholomew's in London. And the gist of the talk that I gave yesterday was really about the importance of hypertension control in aortic dissection. I think as vascular surgeons, we tend to get a little bit sidetracked looking at devices and trying to think about intervention. But we really need to make sure that patients are adequately medically managed. And especially in the setting of acute type B dissection, I have a sense that this is going to change the natural history of disease. We've set up a beautiful remote monitoring program in St. Bartholomew's, and despite the fact that there is some digital exclusion, we've been able to manage our patients in a really careful way. And I think this is something that we need to look at to augment the value of surgery in dissection.